Imagine this nightmare scenario. You have terrible diarrhea during your trip. You rush to a Japanese drugstore and grab a box that looks effective. But what if that was actually a strong laxative? Disaster, right? Hi everyone, welcome back to my channel. I'm Jun, a licensed pharmacist from Japan. On this channel, I share basic information and introduce healthcare products you can find in Japan. Make sure to check the disclaimer before we start. Japanese intestinal medicines are divided into 3 categories. Look at this chart. Category 1, blue, is anti-diarrheals. They stop the movement. Category 2, red, is laxatives. They stimulate or push the movement. As you can see, they have opposing effects. They do the exact opposite. And category 3, green, is intestinal regulators. They balance the gut flora gently. So remember, red is pushing, blue is for calming. Alright, this is the 3 categories. Now let's look at the active ingredients. First, the anti-diarrheals, the blue group. You will see loperamide. This is a global standard, just like Imodium. It stops the gut movement powerfully. Then there is scopolia extract. This is rarely seen as OTC in the West. It works on nerves to stop powerful cramps instantly. And Japan has a unique one, wood creosote. It kills bad bacteria and regulates water balance. But be warned, it has very strong smoky smell. Okay, next. The laxatives, the red group. The safe choice is magnesium oxide. It uses water to soften the stool gently. It is non-habit forming, and if that's not enough, there is Wakodo. It stimulates the gut directly. It is strong, so be prepared for some cramps. Also, we have malt extract. This is mainly for infants. Finally, the regulated, the green group. These are simply probiotics and dried yeast, brewer's yeast. Just like yogurt supplements, but it's safe for everyone. Okay, this is the main active ingredient in gut medicine. Let's start the blue team with the technological marvel, Tomedain Kowa film. This is not a tablet or powder. It is a super thin film. The pharmaceutical feature is amazing. You just put it on tongue. It dissolves instantly with your saliva, so you can take it without water anywhere, even during a meeting or on a crowded train where you can't escape to the bathroom. The active ingredient is loperamide. It acts directly on the intestines to stop the excessive motion powerfully. By the way, there is also tablet type, Tomedain Kowa tablets. It contains 4 extra ingredients to fight stomach pain and gas. So if you just want to stop diarrhea quickly, choose the film. If you have severe pain too, choose the tablets. Now please listen to the warning. Rule 1, age limit. Only for 15 years and older. Under 15 cannot use it. Rule 2, no driving. It causes drowsiness. Rule 3, stop immediately. Once the diarrhea stops, do not take another dose, otherwise you will get constipation. Rule 4, infection warning. If you have a fever or a bloody stool, do not use this. You need to let the bacteria out. Go to a hospital. Alright, this is the explanation of Tomedain Kowa film. Next up is product number 2, Stoppa Anti-Diarrhea EX. Have you ever felt a sudden violent urge just before an important meeting or while trapped on a train? This medicine is designed exactly for that nervous stomach or sudden diarrhea. This main ingredient is scopolia extract. Unlike Tomedain, scopolia works for nerves. It blocks the panic signals to stop the powerful cramps and the urge to go. It also contains Biofermin to fight bad bacteria. The best part is usability. It is an OD tablet, orally disintegrating. It dissolves quickly with a grapefruit flavor, so you can take it without water anywhere. However, scopolia extract has specific risks. Please listen carefully. Warning 1. If you have glaucoma, do not take this. It creates pressure in the eyes. Warning to breastfeeding, nursing mothers should avoid this, as it can pass into the milk. Warning 3, mouth and eyes. It causes dry mouth and blurred vision, so strictly no driving. Okay, this was the explanation for the Stoppa Anti-Diarrhea Medicine EX. The final member of the Brew team, this is the legend of Japan, product number 3, Seirogan. Before explaining the effect, I want you to try something. Pick up the orange box and bring it close to your nose. Can you feel it? You can already smell it a little. Even from the outside, it has a strong pungent smell like burnt wood or creosote, which might be surprising at first. This is the powder of main ingredient, wood creosote. This ingredient kills bad bacteria and regulates the water balance. So if you suspect food poisoning, this is the best choice in the routine. But wait, I can't handle this smell. Don't worry, look for the box next to it. Seirogan Toy A. It is sugar-coated and has no smell, easier to swallow, but works just as well. So that concludes the stoppers. But what if your problem is the opposite? Let's move on to the red team. It's the time to unblock your system. Now let's look at the red team. These are for constipation. Travel constipation is very common due to dehydration on planes or lack of vegetables. First up is a gentle choice. Product number 4, Magnesium Oxide, Constipation Relief. Look for the pink box with a big letter E and a smiling character. The active ingredient is magnesium oxide. This is a non-stimulant laxative. It does not force your gut to move violently. Instead, it draws water into the intestines to soften the hard and stool. So it's less likely to cause stomach pain and is non-habit forming. Perfect for first-time users. Here is a pro tip for the best results. Since it works by using water, you must drink plenty of water when you take it. The tablet itself is lemon-flavored and melts quickly in your mouth. It's easy to swallow. Take it once a day before bedtime or on an empty stomach. It is safe for ages 5 and up. However, if you have kidney disease, please consult a doctor first. Next, if you have stubborn constipation, here is a heavy artillery. Product number 5, Colac 2. Look for the pink box. This works completely differently from magnesium oxide. It contains 2 key ingredients. Bisacodyl. This directly stimulates the colon muscles to push the stool out forcefully. And next, sodium dioctyl sulfosuccinate. This allows moisture to penetrate hard-ended stool to make it softer. Basically, it softens and pushes at the same time. Basically, take it before bedtime. It usually works the next morning. Since it is strong, start with just 1 tablet. You can increase up to 3 if you need it. Also, be prepared for some cramps or abdominal pain. This is a sign that your gut is moving. Now, a special mention for families traveling with baby. If your baby has constipation due to the stress of travel, look for this box. Wakodo Malt Extract Stick. This is a gentle laxative designed specifically for infants from 2 months. The ingredient is 100% malt extract. It makes the stool soft and increases the volume to help the baby push it out naturally. It is a syrup stick with a subtle sweetness. Just mix it into warm water or milk. Babies love the taste, so it is very easy to give. Warning, do not give this newborns under 1 month old. Okay, it is the safest, most natural choice for your little one's tummy trouble. Finally, for the red team, here is the last result. Product number 6, Ichijiku Enema 40. If you are in severe pain and cannot wait until tomorrow morning, this provides immediate relief. The active ingredient is glycerin. You inject it directly to lubricate and stimulate the rectum. It works incredibly fast, usually within 3 to 10 minutes. But here is the trick. After injecting, do not go to the toilet immediately. You must wait for about 3 minutes until the urge becomes very strong, otherwise only the liquid will come out. Also, please avoid continuous use. If you use it habitually, the effect will weaken and your body may stop responding. So keep it as your special helper for tough times only. Finally, let's meet the green team. These are intestinal regulations. Unlike a blue or red team, these are not for stopping or pushing, they are for balancing. Product number 7 is the king of probiotics in Japan, same Biofermin S. Look for the white box with a big orange S. It contains 3 types of lactic acid bacteria. They work comprehensively from the small intestine to the large intestine. It brings your gut flora back to normal. So it works both loose stool and constipation. It is essentially a high-quality supplement. It is slightly sweet and easy to eat. It is safe for the full family, ages 5 and up. If you have a baby over 3 months old, buy the fine granule type, powder type. If your stomach feels off due to the unfamiliar food in Japan, take this after every meal. Okay, finally, product number 8 is Ebios tablets. This is a very unique medicine. It is made from dried yeast, specifically Brewer's yeast. It works in 2 ways. First, it helps the good bacteria grow to fix your digestion. Second, and most importantly, also it provides nutrition. It is packed with vitamins, minerals, and amino acids, so it revitalizes a weakened stomach. If you feel tired or have lost appetite from traveling too much, this is perfect. However, get ready for a surprise. The dosage for adult is 10 tablets at a time. Yes, 10 tablets 3 times a day. That is 30 tablets a day. Don't worry, they are small and easy to swallow. It is so safe that even pregnant women can take it for nutritional support. This is the explanation of Ebios. Great job everyone. Let's quickly recap the golden rules for your next trip to the drugstore. Remember the cards? If you need to stop for diarrhea, choose the blue team. If you need to go for constipation, choose the red team. Do not mix them up, they do the exact opposite. Finally, please remember the safety warning. OTC medicines are for mild symptoms only. If you see bloody stool, have a high fever, or if the severe pains does not go away, stop taking medicine immediately. These are signs of serious infection or illness. Go to the hospital right away. Okay, your health comes first. Choose wisely and enjoy delicious Japanese food with a happy stomach. Thanks for watching. See you in the next video. お疲れ様でした。